Hi everyone. For my the STD that I chose to talk about was syphilis. And a little bit about syphilis. It's a very serious sexually transmitted disease because it can cause severe damage in almost any organ of your body. So it's important to stay away from it as much as you can, and just really look for it, especially if you're sexually active. The type of pathogen that syphilis is, it's caused by a bacterium called Treponema pallidum. And some facts and statistics about it. There are 3 stages of syphilis. That's primary, secondary, and tertiary. Back in 2016, there was approximately 88,000 new cases that were reported in the United States, which is compared to less than 6,000 cases reported in 2000. The number of primary and secondary syphilis cases that has increased by 13% between the years 2017 and 2018 to 35,000, which makes up 115,000 cases in total. As of newborn syphilis has also increased 40% to 1,300 cases. And currently, syphilis is just a disease of gay and bisexual men, but it's also increasing among heterosexual men and women as well. Some modes of transmission. Syphilis can spread from person to person by direct contact, by cankers. It can spread during vaginal, anal, or oral sex from direct exposure of a canker. Pregnant women can also give syphilis to their unborn babies, which is scary. Even though syphilis is currently a disease of gay and bisexual men, it can still spread to anyone by direct contact, which means we should all still practice safe sex. Some signs and symptoms. A sign of syphilis is a canker, which is in the primary stage, and it's very contagious. It can last up to 4 to 6 weeks, but it eventually heal over time, even if you don't take care of it. The secondary stage consists of like a rash, elevated temperature, and large lymph nodes, or even mucus patches. And this can last up to several weeks as well, just like the canker, and it will also eventually subside even if you don't treat it. In the tertiary stage, the organisms that are running are still active and could cause damage to your cardiovascular system and your nervous system, and even organs like your liver, your joints, your bones, and even your eyes. So with all of this damage, you could show symptoms of numbness, hair loss, blindness, dementia, loss of muscle coordination, and even sometimes death, which is also really scary. How men and women differ with syphilis, it's not a ton to differ from. Men and women are still both at risk of contracting syphilis and even experience the same stages and symptoms. And even though the severity of the symptoms can differ between person to person, it's still generally the same between both sexes. Some tests that can be done to establish diagnosis. A test that you can do to see if you have syphilis are the serologic tests. And these require to test the non-treponemal test or the treponal test. And then the people that are at greatest risk, most of the United States cases are among gay and bisexual men, like I mentioned earlier. A treatment that you can do to treat syphilis is with penicillin, and just a single injection is the best treatment if you've only had it for a year. And if you've had it for more than a year or several years, you'll do more than one injection, even sometimes a couple times a week. The best way to stay away from syphilis, to prevent it, is to avoid having sex or even just being monogamous. Or you could also use a condom or just avoid drugs. And yeah, that is syphilis.